All right. Welcome back. This is the Call Movement podcast. And today we're talking about something that many women don't think about until later in life, which is bone health and what women can do now to stay strong and active as we age. And I am very excited to have Dr. Lora Giangregorio to the podcast. Is a professor, Tier 1, Canada Research Chair in Bone Health and Exercise Science in the Department of Kinesiology and Health Science at the University of Waterloo. She leads Bone Health and Exercise Science Lab, also known as
Bones Lab. Yeah.
Bones Lab.
Yeah.
Awesome. And with her team, she focused on research related with physical activity, fall prevention, and fracture prevention. I don't know why, but I'm a bit nervous, so forgive me.
No worries.
I think I've been so excited to have this conversation with you.
Yeah.
Thank you so much, Dr. Lora. What did I miss here in your introduction that you think would be beneficial for my listeners to know about you?
I think given that your podcast is focused on women's health and women's health after a certain age, I think I remember you mentioning. I mean, I am a 50-year-old woman, so it's also a podcast that is aligned with kind of the demographic. I am, I guess, part of the demographic that you're targeting. So I kind of understand personally also the perspectives of women in middle age. So
That's awesome. So welcome. And I'm going to dive in straight to the questions because those are questions that I'm very interested to learn. I had a little side conversation with you. There is so much on the internet, on Instagram, and I feel a lot of us are getting information, actually more like misinformation. That's why I am so happy to have you here because you can walk us through talking about bone health. What are we as women are getting completely wrong about bone health these days?
yeah, I think that many people perceive bone health as a woman's disease and as a disease of older people. And both males and females can experience bone loss and osteoporosis. And you can actually experience, it's not just an old person's disease. So there are people who experience bone loss due to certain health conditions or medications or surgeries that affect their body, that it can affect either bone metabolism or hormones that affect bone metabolism. And so you can actually lose bone as a result and experience osteoporosis at earlier ages. So I think that understanding all the things that contribute to bone health, and also that we build most of our bone when we're really, really young. So the things that can influence our bone health during youth can actually have an impact on bone later on. So I like to think about, osteoporosis is a disease that happens based on the accumulation of, experiences that affect bone, and that can happen throughout your life. But it often manifests in older age because it's this accumulation of age-related loss, hormone changes, other diseases or conditions that affect your bone. And so all of these start to add up and cause bone loss throughout your life, as opposed to like all of a sudden you hit older age and now you have this disease. Like I think it's a bit more complex than that.
And you touched something that it's very close to me and a lot of moms that I have a 7 and a 9-year-old. They're highly active and clearly they're forming their skeleton. And is there anything that we can help them to at this age to have stronger bones for later in life?
Yeah, I think that you want to make sure that people are getting adequate calcium, vitamin D, protein, calories, as a starting point, because these are all important nutrients for overall health and for bone health as well. So, for example, you need calcium to build healthy bones, you need magnesium, you need vitamin D. And depending on where you are in the world or what you eat, vitamin D is affected by sun exposure.
Mm-hmm.
As well as what you eat. And then, what you eat, these can affect these nutrients. And so you want to make sure you're getting enough. So paying attention to eating a variety of foods, making sure you're getting the foods that have those things. A protein helps us build muscle. Muscle pull on bone is important for a stimulus for bone. So having enough muscle and then having enough calories. So some very active kids may inadvertently undereat for the calories that they burn, and they may not be getting enough calories. So that can cause them to be thinner than they need to be or lose muscle, or people who are focused on weight loss. So people sometimes have clinical or subclinical eating disorders, and that can actually contribute to suboptimal bone growth. Like, so they may not build as much bone as they could, or they may actually lose bone. So we want to avoid those scenarios as well. And in athletes, sometimes, again, because of inadvertent undereating, especially for endurance athletes, right? So there's a lot of kids who like to do cross country or, other endurance sports, and they have to make sure they're getting adequate calories for those sports, right? So that's one thing. And then being physically active, incorporating impact exercises. And then I actually encourage people to start building habits around exercise, of the different types of exercise. So, in your teens, like, why not start a strength training program and incorporate exercises that affect muscular power and balance, so that you can build a habit that these are part of your life. Because I think that sometimes what happens is people, as kids, they get involved in sports, and then their physical activity is sport related, and then they transition into high school and have different priorities, and they no longer participate in sport, or they participate less often, and then they transition to adulthood, and then they have less time for sports and organized things. But they haven't developed the habits that physical activity is part of their life, whether they're part of a sport or not. So I think it's important to help people understand the importance of being physically active, not just as part of sport or social, but just as part of a habit in your life, so that you can stay strong. So encouraging kids to that, why physical activity, and modeling that, right? As a parent,
Mm-hmm. Mm-hmm.
going to the gym and doing the strength training, or doing the strength training at home, or doing, physical activity every day, and also having it as part of your family activities, so that you're modeling it and showing that it's important to have that commitment for health reasons.
And you talk about, I do understand how important strengthening exercise it is for bone health. Can you tell us a little bit more? Why is it so important? Why everyone keeps saying strengthening exercise, impact exercise? This is gonna go, it's good for you for longevity. Can you give us more like detailed of why we keep having this discussion and over, and how important it is strengthening training?
Well, and I think that's more about, like, we know when we look at, most national physical activity guidelines have recommendations for adults to do moderate to vigorous physical activity and strength training. So part of it is just developing habits to make those types of things, because that's what is recommended a habit. And I think the reason why for bone health you see these recommendations specific to impact exercise and strength training has to do with the several lines of evidence that point us towards these types of exercise. So, for example, if you look at athletes, you can see that athletes that do sports that either involve very high forces or multi-directional movements or impact tend to have higher bone density. So either high muscle forces or high impact, usually, right? So swimmers and runners tend to have lower than average bone density, whereas like basketball players and soccer players and gymnasts tend to have higher than average bone density. So that's one layer. If we look at animal research, we see that short, high force or high impact or high strain rate activities done in short bouts tends to be a good stimulus for bone. And then if we look at studies done in postmenopausal women, there's not as many in men. That's why I focus on the studies in postmenopausal women. But studies in postmenopausal women show that the types of exercise, the studies that have most often shown an effect on bone are ones that do strength training or impact exercise, or those combined. So that's why we tend to emphasize that, because if we look at the evidence, we kind of have these several lines of evidence that point us in that direction. There's no like really conclusive answer of the one type that is the best. And actually, it's really hard to dissociate high force exercise, like strength training without impact, for example, versus impact exercise, and whether one is better than the other or whether one can replace the other. So when we look at studies, they often combine them. So it's really hard to know if one is better than the other or more important. So I usually suggest people try to do both, just so that, and I think they both probably are a good stimulus. If what you want is slight deformations in the bone, so muscle pulling on bone can kind of apply kind of a bending force. Impact can apply that force, and that's what you want to stimulate bone cells. And I think, based on animal research and based on what we see in humans, probably moderate or higher forces or impacts rather than lowered seems to be better. But again, it's really tricky because we don't have studies that say compare different types of resistance training or different resistance to impact. We don't quite have those studies to make conclusive statements as to one is better than the other, or it has to be this level of impact and that's the only one that works. We see that on social media a lot, and actually we don't have evidence to say that for sure. But what I can say is that the studies that have looked at this tend to look at moderate or high impacts and tend to be, moderate or high intensity strength training. So probably those layers, but I don't know necessarily that we can say conclusively that it must be this level of impact or must be this type of strength training. So I don't know if that answers your
We
question.
must have some sort of resistance or impact training. And if we do, for my busy moms I don't have the time to go to the gym. What can I tell her if she's listening to you? Like, of course, I want to go to the gym and do my strength training and lift weights and do squats with a barbell. I just don't have the resources. Maybe I don't have the money. I don't have the membership. How can we lower these barriers and make this a possibility that they can do from the garage? Or I always say, go on a hike uphill, 8% incline. But I'd like to hear from you. Is that a solution for those women who cannot have access to the barriers?
Yeah, I usually say to people, start where you're at and start with what you have. Like, you're better doing what you can do than not doing anything at all. And there are ways to challenge your muscles and your bones without going to a gym. So you can do pretty challenging exercises. The caveat is that you have to have a baseline knowledge of how to design that exercise program and how to progress it over time and do the exercises. So you just have to be a bit more creative, right? So actually, a colleague of mine who's a physician, she was like, I can't, same scenario. I'm a mom. I need to exercise at home. It has to be quick. So I'm like, okay, you can't do a barbell deadlift, but you could do it with dumbbells. And so I taught her how to do that. And she's quite strong and got strong quite quickly. And she's like, okay, I'm doing, RDLs with 40-pound dumbbells. And now my hands are sore and I can't really lift much more, but I need to make it harder. And I said, okay, well, you can switch to a kickstand or B stance type Romanian deadlift because that'll make it harder without you having to increase the weight that much, right? But that's because I can do that and I can be creative and nimble and kind of help her. So the caveat is that if you want to work out at home and you want to design an exercise program with the resources you have, you might need to get some tips from from someone who knows what they're doing around how to design that. So you can do quite challenging exercises with body weight, with a set of dumbbells, you can do impact exercises at home, like without any equipment at all. But I think it's just about knowing how to appropriately tailor it for your abilities and then progress it over time within those constraints. And that's where they might need to maybe consult an exercise physiologist to give them some guidance on that, unless they know. I don't know if that answers. Hopefully that.
No, it's perfect. I just want to make sure we still have the ability
Yeah.
to challenge our bodies,
Yeah.
regardless if we have accessibility to a gym.
Yeah.
We're going through a perimenopause, menopause, and with that, our bones start getting weaker,
Hmm.
correct? What can we do to prevent that? What can I do to make sure that my bones are as strong as possible so I can avoid any risk of if I fall, I catch myself very fast, balancing mobility. But the question here is like perimenopause, menopause, weakness of the bones, and reversing that situation for longevity.
So there's a couple of layers there. So I'm gonna
Okay.
put a pin in the balance part, and we'll
Okay.
focus on the bone strength part.
Okay.
So the first layer is do everything you can to maximize your bone health during youth and then prevent modifiable bone loss during middle age. So that means getting adequate nutrition, getting in terms of calcium, vitamin D, protein, calories. If you're trying to lose weight, so this is where strength training can help in the sense that if you're losing weight, a lot of women want to lose weight for their body image, for their body composition. But when you lose weight, you often lose muscle, bone, and fat, right? So you can try to prevent bone loss during weight loss by making sure you're getting adequate protein, doing resistance training, doing these things that help hold on to the bone mass. So that's one thing. But then there's also like exposures that are modifiable. So, for example, smoking is a risk factor for osteoporosis. Alcohol intake greater than 3 units a day is a risk factor for osteoporosis. Having really low BMI is a risk factor. So, addressing these modifiable risk factors throughout your life, not just in older age, can potentially help maximize the amount of bone you have in middle age and prevent loss of bone in middle age. Once women are going through changes around menopause, the big issue is they have declining estrogen levels. And so
Mm.
estrogen helps to prevent osteoclasts from breaking down bone. And so it kind of keeps them in check. And so in the 3 to 5 years surrounding menopause, some women will experience, most women will experience bone loss, but the amount of bone loss they experience is variable. And this, we don't really know, like, it's not like you can predict like who's going to lose more or less. Some of it may be genetic and may be related to other exposures, but women tend to lose bone around menopause. So some women will use estrogen as a treatment for menopausal symptoms, and this sometimes can also prevent bone loss. So whether or not someone uses hormone replacement therapy is a discussion with their physician, and I'm not going to get into why we do or do not choose that. I'm not a physician; it's not my place. So some people will do that. But I think the biggest thing is trying to prevent these modifiable causes of bone loss and then doing what you can to maximize the bone you have. So doing the resistance, the impact, getting adequate nutrition, avoiding things that negatively affect bone. So there's many medications that affect bone. And so when you're making decisions around medications, understanding if it affects your bones, that sort of thing, keeping certain health conditions under control. So for example, people with celiac disease often
Mhm.
have low bone mass, and that has to do with the fact that it's a condition that affects your absorption of nutrients, right? There are other diseases similarly that can affect bones. So you want to manage them well, because if you manage them well, then they have less of an impact on bone. Diabetes is another example. So diabetes can affect bone strength and fall risk. And so you want to manage diabetes well so that you don't have those negative impacts. So I think that's the biggest thing for me is avoiding modifiable causes of bone loss. There's some that are not modifiable. So if you happen to be a person who develops breast cancer and you have to go on a medication
Mhm.
to prevent, the cancer from spreading, or to, like that then has a negative effect on bone, you're going to choose obviously the medication to treat your cancer. And this is not something you can shy away from. But smoking or not smoking, drinking excessive alcohol, not getting enough nutrients, this is possibly a modifiable risk factor.
And then you keep mentioning osteoporosis. I do understand what it is. Can you do a little simplistic translation of what is osteoporosis? Is it genetics? My family has, and I grew up with my mom telling me that it's genetics. There's nothing you can do about it. Just embrace it.
So osteoporosis is when you have a reduction in bone density or reduction in bone strength that increases your risk of fracture. So that's what it is. And it's defined, so it's kind of tricky because the definition of it is, you're at increased risk of fracture. But when the World Health Organization kind of defines it based on bone density, so it's a certain level of bone density. And then people who have, so there's like normal bone and there's osteopenia, which is kind of in between, and then there's
Yes.
osteoporosis. And then when you go to the doctor, they usually do an assessment of your risk factors. They might decide to do a bone density, and then they'll combine the bone density with your risk factors. And they may use a tool called FRAX to actually calculate a risk of fracture, probability of fracture in the next 10 years. So some people will be diagnosed with osteoporosis based on their bone density, and then some people will get a probability of fracture based on FRAX, and those are slightly different things. One is more used as a decision making around like helping decide on whether someone should go on medication, whereas like the osteoporosis definition is just based on bone density. So I don't know if that makes any sense, but
It does.
in the diagnostic space, there's different ways of looking at bone. Is the whole probability of fracture versus bone density based on an X-ray, based on the more general definition of osteoporosis, which is low bone strength and an increased risk of fracture. And then you asked about genetics. So there's many things that contribute to osteoporosis. Genetics is one of them. But again, there's postmenopausal bone loss, there's age-related bone loss. So we lose bone with age. So if you think about, you start in youth with this much bone, you're going to have bone loss with age, and then you're going to have bone loss related to declines in hormones, both for men and women, but more so for females. And then you're going to have bone loss related to any other risk factors. So osteoporosis is, again, an accumulation of bone loss, essentially, depending on which of those things you're exposed to. So everybody's going to be exposed to age-related bone loss. Females will be exposed to, or people with a uterus will be exposed to bone loss related to menopausal changes. And then you'll have all these other potential causes. So people who excessive alcohol or have celiac disease or whatever, then so osteoporosis can happen because it usually happens because of a combination of things,
Okay.
right? It's not just only genetics or only menopause or only this. It's many different things can contribute.
Which brings me back. This is my own personal question. I got very interested in bone density, bone health, and really trying to understand this subject area. And last year, I connected with my health insurance and I said, I want to do a body scan because I want to see where I am with my bone health. Um, and my health insurance denied. She's like, you're not a 60 years old. But if my parents already told me I'm going to have osteoporosis, I want to know ahead of the time so I can be preventive. Why do we need to wait until 60 to figure out how healthy is our bones?
Yeah, so I think there's a couple of things to consider. So one is you're very unlikely to have low bone density at, like a younger age. So it does happen. And so there are scenarios where someone who is under the age of 50 would be eligible for a bone density, or under the age of 60 would be eligible, but they would have to have certain risk factors. So the ISCD, or the International Society for Clinical Densitometry, has guidelines on who should have a bone density at a younger age. And so it's like, okay, if you had celiac disease, or if you've had a fracture in a really weird scenario that we wouldn't expect, then they might send you for a bone density. But if you're a young, healthy person with no risk factors, the likelihood of you having low bone density is very low. So it's really, from a screening perspective, it's not a good use of healthcare dollars. And the other thing is, you would do a bone density to help you make decisions around healthcare, and you would be very unlikely to be a person they would put on medication for osteoporosis at this age, because your fracture risk because of your age is probably quite low. So it's not the only thing you might do is focus on your nutrition and exercise, which you don't need a bone density to tell you to do that, right? So I think there's a couple layers there, and it's an X-ray exposure, right? So you're exposed to ionizing radiation. So there's actually risks associated with very low risks, but there's no, like, if you're going to have a series of X-rays throughout your life, you wouldn't want to increase it for not a good reason, right?
Got it.
So there's not really a lot of information that it's going to give you to change your behavior right now. When you're older, the chances that you might have experienced postmenopausal bone loss, or if you have risk factors, so in Canada, it's kind of like, okay, if you're this age and you have two risk factors, they'll send you, right? And so I think it's below 65, and you have two risk factors, they'll send you. Whereas if you're above 65 and you have one, they'll send you. So there's like a algorithm based on age and risk factors, depending on, whether they'll send you. But at a younger age, they typically won't approve it because they don't see it as a good use of healthcare dollars, because it's not likely to affect your care.
I have few regrets for feeling frustrated during that time, but it makes sense. And I couldn't comprehend. I was just want to be proactive and preventive.
And the
But
likelihood is you'll come back and they'll say your bone density is normal.
yeah,
right?
it makes sense. So we can
There's a
put
very, very low chance that you would. Now, it does happen. There are scenarios, but there was someone I went to school with, and we were both learning how to do bone density scans. And this was when we were in our early 20s. And I did her bone density, she did mine, and she actually had very low bone mass. But in hindsight, she had had two fractures the year before, and in a really kind of weird scenario. And then it all made sense, right? Because she had really low bone mass. And so I think I don't want to speculate on what her reasons were, but so there are scenarios, but usually they would have risk factors, and then the physician would say, okay, yeah, you should have it because you have celiac disease, and how you have a family history and whatever, then they might do it, right?
for a healthy women in their 40s, no mental health issues. Is there a way that the body is going to send you signals for your bone is not that strong?
No,
Is there no? Okay.
there's no symptoms. You don't feel
There's so
bone loss.
okay.
You can't feel how strong your bones are.
Okay.
Often, sometimes for people, the first sign that they have osteoporosis is a fracture.
Mm,
So unless through screening it's detected, right? So that's why it's really important when people do have fractures in events that wouldn't normally cause a fracture, that they do be sent for a bone density test to see if they have osteoporosis so that they can take action.
okay. Now, let's talk about exercise and bone density. Let's go back to that subject. Is there any specific exercise that you think that is very effective for supporting bone density? If so, what are your recommendations?
Yeah, so I think that I would recommend that people do moderate to high intensity strength training for most bones of the body, or sorry, muscles of the body, and then also some impact exercise. Ideally, and the thing is, kind of impact exercise, you want to, just like strength training, you kind of start where you're at. So you wouldn't go and do, depth jumps or drop jumps without ever having done them before. So I think about approaching impact exercise like a continuum. So you might start with resistance training, get your body used to high forces, and then maybe start doing some faster movements or power training so that your body's used to really high speed movements and recovering, from those types of movements. And then maybe start introducing hops and jumps and stuff, and then progressing the level of impact over time. So I would approach it that way. And the same with resistance training. You pick your exercises that you're going to do, you learn how to do them with good form, body mechanics, work on that, and then eventually start progressing the intensity of the exercise or the difficulty level. When we look at the new ACSM guidelines for strength training, they suggest that for muscle strength, you want to, do 80% or more a 1RM, but that you can improve strength with all intensities as long as it's progressive and consistent. And I would say the same, like, we don't know for sure for bone density, but my guess would be it would probably be the same. So probably, like, if you take someone who's never strength trained and they start, even if they're doing it at a very low intensity, they're probably going to at least maintain their bone mass, maybe not high increases, especially in a period of loss. So if I was to say like optimal, probably on the higher, moderate to high intensity. But we really don't actually know because there's not studies that compare them. But I would say, like, I would lean towards a moderate high. So like that would be like, if you're doing squats, you'd want to pick a weight that you can do 6 to 8 repetitions, and you maybe have 1 or 2 left in the tank. And so if you can do like 10, 15, 20, then it's probably too easy. So that's what I mean by like, 80% of 1RM would be like 6 to 8 repetitions maximum. Does that make
Okay.
sense?
It does. And then how many times a week?
Great question. The guidelines say minimum of 2.
Okay.
Some people argue that 3 is better for certain types of a development. Like, you see all these glute development programs online, and they say you need to do it 3 times a week. I'd like to keep it like, let's aim for 2 so that we can be consistent, because
Yeah.
consistency and progression is most important. So I would say pick what you can stick to. So either twice a week full body, or if you're doing a split routine, make sure you hit each muscle group twice a week. And for impact is a bit trickier to answer that question because, if we look at studies in animals, short, frequent bouts multiple times a day is actually what's effective. So, avoid long periods of sedentary behavior, get out, and do short bouts of impact, would be ideal actually. But we don't
Can I
have
just
studies that compare different impact protocols. So I can't say that conclusively in humans, but we do know that people who do impact sports where they're moving in multiple directions, high impact or powerful movements, they tend to have, and they tend to train at a pretty high volume, right? Like,
yeah.
so if you could incorporate it in your everyday, that would be great.
I love that you just said it's about the consistency and progression because these days everything is a hack, everything is a shortcut. Everyone wants results right away. So consistency over perfection. And I love that. A lot of my peeps, they're like, we just like walking. Is that enough to support bone health?
There are some studies that show that walking, people who walk regularly are at lower risk of fracture. People who walk, there are a couple studies that show that walking might maintain bone density. But I think if you're really trying to maintain or increase bone density, you probably need higher force activities, whether that's higher muscle force or higher impact, just based on when we look at the animal research and some of the human research. Like, because again, we look at runners and they tend to have lower than average bone density. And part of that is it's a bit complicated because runners often also have really low body weight and sometimes have a higher prevalence of eating disorders or inadvertent under eating because they burn a lot of
Mhm,
calories, right?
mhm.
And so it's a bit tricky to interpret that literature. But I would say, like, probably you want to incorporate some strength and impact training that is higher impact than just walking, if that's doable. There's some people who have health conditions that where impact exercise is not realistic for them. And so
Mhm.
for those people, I would say lean more heavily on the strength training and maybe incorporate some power training. So more faster, higher velocity movements. And so like doing the squats really fast or, doing other types of strength training movements with a bit more speed to them under, safely, obviously. So you have to work up to that, but that's what I would do if you can't do impact exercise.
And then one last question. I don't have a good relationship with weighted vests, and I can't stand hearing about them.
Yeah.
Ever, it's all over the Instagrams. It's all over how weighted vests have been helping women with bone density and hormones. And based on your knowledge, is there any research out there that confirms those claims?
So the studies that have been done, we actually just completed a scoping review on this topic. We haven't published it yet. And so one of my students actually went through all the literature and I had done this a while back because I saw like all the menopause influencers wearing weighted vests. I'm like, I'm pretty sure there's not a lot of good evidence. So I actually looked. And what's really interesting to me is they all cite this one study that was done and they say women who wore weighted vests for 5 years increased their bone density. But what they don't cite is the original study. So that was actually a follow-up study. The original clinical trial that research group did randomized people to weighted vests and no weighted vests and saw no effect on bone mineral density. Then what they did is they called these people 5 years later and asked them to come back. And only a small portion of them came back. And the people who came back and were still exercising had a higher bone density than the ones that came back and weren't exercising. Let me ask you, do you think the people who 5 years later were willing to come back to the lab and still doing the exercise are different than the people who didn't come back?
Oh,
Right?
really?
Probably, right? So the original trial showed no effect. And it was only this follow-up in this sub-study that showed an effect. And it's very likely due to attrition bias. And many other studies have looked at weighted vests and bone density, and the results are very inconsistent. And many of them show no effect. And there was a recent trial where they actually took people who were overweight and they randomized them to diet alone, diet plus resistance training, diet plus weighted vest. And the weighted vest did not prevent bone loss during the weight loss intervention. So I think it's really important for people to understand that you have to look at the body of literature and not just one small sub-study. And most of them show that the weighted vests aren't going to move the dial on the bone density. Now, a weighted vest is a way to increase resistance. So if you're doing resistance training and you have I think about where it might be a good scenario is in a person who can't hold weights in their hand or they're going from body weight squats and they need a bit more of a challenge. Adding a weighted vest is going to add more of a challenge. So I think about someone who has a stroke, who has paralysis on one side and has difficulty holding weights and balancing. Putting a weighted vest on and getting them to do sit to stands is a great way to increase the challenge. So I'm not saying weighted vests are useless, but I would not replace strength training with barbells and dumbbells with a weighted vest because you can't add a lot of weight with a weighted vest, right? You can only add like a certain percentage of your body weight, a very small percentage. So it may not actually be challenging enough to stimulate bone compared to, say, moderate to high intensity strength training or impact program. It's not going to be the same level of impact as when you walk with a weighted vest. The other thing is, again, it's short, high impact that is effective, not prolonged, slightly higher than normal impact. And wearing a weighted vest for an hour while you're out walking is not that comfortable and
No.
actually could increase your risk of injuries or repetitive strain. And many people actually report, you just look anecdotally and some of the people are saying, I hate it. It feels awful, hurt my neck, etc. So it's not like it's without harm either. So I would say, like, if your goal is increasing your bone density, a weighted vest is not the right choice. Unless like you have a stroke and you need to train with it for that reason, or you have rheumatoid arthritis and you can't grip weights and that's your only way of it. Like there's some scenarios where I'd say, yeah, that's probably a good choice for you. But most people, I would not choose it.
Thanks for clarifying. Let's put this myth down. And then that's why I say invest, just get a jump rope, $5, $10.
Yeah.
You don't need a weight bet. So I'm so thrilled with our conversation. I know our time is up. I want to be, thoughtful. I appreciate all your time. I hope this podcast can help all the women out there, including myself, who had all these questions, all these confusions about bone health and staying strong. I think an excellent point is for us as mom to make sure our kids are getting the right nutrients so they can have a good bone health as they get older. I love that segment. So I appreciate your time. And for all the women who's listened to this podcast, if this resonates to you, please share. And I'll see you next time.